first of all, congratulations. You are definitely embarking on a journey, and it is probably going to be the most exciting and rewarding of your life. So you've probably done lots of planning and decorating and unwrapping presents, and so oftentimes you forget to think about what's next. So, my best piece of advice is relax and enjoy the process. The pregnancy goes fast, the first year goes fast. So relax, enjoy it, and just remember that you probably have all the same questions as everyone else sitting in the room. I've pretty much heard it all, so feel free if you want to ask questions during the presentation, that's no problem. So I've put together a list of some of the most common questions that I get. So actually, this is one of the most common. How will my pediatrician know that baby has been born? And I would like to pretend it's something exciting and high-tech and cool like this, but actually it's pretty simple. You will be presented with a list of pediatricians at the hospital, and you'll circle your doctor, and we take care of the rest. Traditionally, I can speak for the hospitals that I'm on staff at. We see babies within 24 hours of birth. So what if my pediatrician doesn't come here, or what if I haven't chosen one yet? If you have not chosen a pediatrician, thought about it, this is something to start working on now. You do not want to wait until you're on labor to be thinking about this. If whatever happens, you haven't gotten there yet, or you have chosen a pediatrician not on staff where you deliver, we have what's called unassigned on-call babies. And what that means is basically we doctors on staff take turns seeing babies whose pediatricians are not available for whatever reason at the hospital. So you get whoever's number is up that day, and we take care of you in-house, and then afterwards you follow up with your pediatrician that you've chosen. So how long will you be in the hospital? Typically 48 hours is pretty standard for a vaginal delivery and 72 hours for a C-section. Most common reasons that people hang around a little bit longer are going to be either weight loss or jaundice in the baby, or maternal factors. So mom's having blood pressure issues, something like that. We don't kick baby out. All right. The other situation is if you are positive for Group B strep, or GBS, you'll hear people call it, baby will usually be monitored for a minimum of 48 hours to make sure that everything's okay. Group B what? I get asked all the time. So Group B strep is a bacteria that colonizes the reproductive tract of women. It's a colonization. It's something that you walk around with most of your life. You have no idea it's there. It's not a sexually transmitted disease. Causes no problem in mom. It just can be transmitted to baby and cause an infection, and so that's why we care. So when will we follow up with our pediatrician? This is something your discharging pediatrician will let you know. So based on weight, feeding, jaundice, that kind of thing. If they tell you to follow up in 5 days and you want to follow up in 1, go for it. Sooner is better, don't hesitate. Most doctors will do a second follow-up after the hospital follow-up at about 2 weeks, and our goal at that point is to regain birth weight. Babies will lose weight the first week, and that's normal. And then usually the next visit after that is the 2-month well visit. Will you really become fascinated by poop? Yes, you will, I assure you. If you are not familiar with meconium, you're going to meet it soon enough. It is pretty gross. It is the first couple of days of stool. It's a thick, tarry, black, yucky substance that's really hard to get off. After that, poop kind of changes to a yellowy green color depending on whether you're breast or bottle feeding. And just keep in mind that infant stooling patterns vary tremendously from baby to baby. There is no exact pattern they have to follow. It is okay if baby doesn't poop every day as long as he's not uncomfortable. I repeat, it is okay. We have people very stressed out over 10 hours without pooping, and it's really just a matter of whether the baby's okay with it. And then stool colors. This is probably one of the most common questions I get. I've even heard Barney purple. So white, black, or red are the bad colors. Black is the exception, is meconium. Like I said, the first day or two, it's going to be pretty black. After that, black, red, or white, consult your doctor for, but pretty much anything else goes. So breast or bottle, I think you're going to be hard-pressed to find a pediatrician who's not for breastfeeding. There is no question that breastfeeding is what's best for baby if you're able to at all. I'm not going to lie, getting started is not easy, and I think that if you go in and expect it to be perfect and nice music is going to play, that you might be in for a surprise. Do use the lactation consultants that are at the hospitals. They are excellent, and they're a great resource. The floor nurses are great help with this as well. And there are some really good outpatient resources available to you once you go home, and that's a really good thing to use if you're at that moment where you're ready to give up. Give them a call. Most hospitals will have people that will come to your home, or it can meet you at an office, and the La Leche League is a great organization that will help you as well. And then your girlfriends that have been through this before, call them. They know how miserable it can be if you're having a hard time. And certainly I hope you have an easy time, but you may need some support. So does baby really need to sleep on his back? Yes, he really, really does. It reduces the risk of SIDS between 30 and 50%. That's huge. If you don't know, SIDS is sudden infant death syndrome. We don't really understand what causes it, but we do understand that back to sleep prevents it. There should be nothing in the crib with baby. It's really tempting to put lots of cute stuffed animals and blankets and fluffy, soft things in there, but they don't need it. If you feel that baby needs a blanket, then at least make sure baby is very tightly swaddled and can't get out. Babies tend to be Houdinis, and so you'd be surprised what they can get out of. So you are just better off dressing them with maybe one extra layer and avoiding the blanket altogether. Pacifier use does decrease the risk for reasons we're not sure of. And then a low-speed ceiling fan is okay. You don't need a windstorm in your room, but a little bit of extra air circulation does make a difference. Not as much as back to sleep, though. Far and away the biggest deal. And then smoke exposure actually does increase the risk. I hear all the time, we only smoke outside. It doesn't matter. Those chemicals are in your shirt, they're on your skin, and so if you have family members that smoke, don't be afraid to remind them of this. They should change their shirt and wash their hands and face before they hold baby. Baby sleeps all the time. Is this okay? Probably so, especially the first day. I mean, I hear it with almost every baby that I go see in the hospital. They've been asleep all day. Commonly, newborns will have nights and days reversed. Those of you who are pregnant can probably attest to the fact that babies get pretty active at night, and unfortunately, it's not going to change when they come out. So there's not much you can do about it. You can give the baby visual cues that it's daytime. Don't be afraid to open the blinds when the sun comes up, turn the lights on, make your usual noise, and eventually baby will sort of, fall into place with your schedule. Babies should be easy to wake most of the time. There are going to be those times, especially during the day, where baby just doesn't want to wake up easily. But as long as it's not every single feed, then you should be okay. If you find that baby is really difficult to arouse, even if you undress her, get her feet wet, make her mad, then she really does need to be examined at that point. So how do we care for baby's umbilical cord? This is one of these nerdy things that pediatricians like to argue about. So the debate is to clean or not to clean with alcohol. And the thought is that if you clean too often, you're going to get rid of some of the good bacteria that helps to get the cord off. And if you're cleaning 8 times a day, your baby may go to college with an umbilical cord. If you don't clean enough, we worry about infection. And umbilical infections can be very serious, and they can set in pretty quickly. So my opinion, what I usually advise my patients to do is just clean once or twice a day, aware that baby's going to probably cry, not because it hurts, but because it kind of feels cold. Is a yellow baby okay? Maybe. Depends on how yellow, how soon, and why they're yellow. So jaundice is yellowing of the skin due to a buildup of bilirubin. And bilirubin is a breakdown product of blood, basically. And this is due to a number of factors. The biggest factor is that the liver is immature in a newborn. So we all, as adults, have blood breakdown as part of our normal body maintenance. We just have a mature liver that can deal with it for us. Babies don't have that, so they have some buildup of bilirubin. If you have any blood incompatibilities, that can increase jaundice as well. Breastfeeding goes along with a little bit of dehydration the first day before your milk is fully in, and that sort of worsens the jaundice sometimes. And then there is a factor in breast milk that does increase jaundice a little bit. So babies who are breastfed are going to be a little more yellow, but it's okay. So I don't know, when I first started doing this, people were looking at babies and saying they were yellow, and I thought they were crazy. It takes time to get to see it. Jaundice does start at the head and work its way down, and so I think the easiest way to see jaundice is to compare the hand to the face, and this is a great picture for that. You can see the baby's hand is definitely a different color from his face. So why do we care about jaundice? When levels get high enough, it can cross the blood-brain barrier and deposit in the brain and cause long-term permanent damage. And the average baby with no issues probably is somewhere between 8 and 12 at a couple of days of age. I'm talking about levels of 25. So this is way higher than hopefully any of you will see. The bottom line is that if your baby is yellow and they haven't been examined and had their bilirubin checked, you need to go right away to see your doctor. This is not something you wait until Monday for. They've studied pediatricians and had pediatricians even with lots of experience guess by looking at a baby, what do you think this baby's bilirubin is? And we're lousy at it. So definitely shouldn't try it at home. Your baby's yellow, go in. What is going on in baby's diaper? This is a well-kept secret. Baby girls can have some vaginal bleeding. Usually happens about day 3, and this is due to mom's hormones. It is basically a hormonal withdrawal. So you're taking baby out of mom's hormonal environment. And it's very similar to being on birth control pills. You stop your pills and then you bleed in a couple of days. It's the same idea. So they can have a little miniature period. Freaks parents out a lot, so good to know ahead of time. For baby boys, unless you enjoy doing lots of laundry, you're going to want to point the penis down. Otherwise, the pee-pee will go straight up. And then urate crystals are common in the first week. And urate crystals are sort of an orangey, pinkish color that you'll see in the diaper. This is a really extreme example, just to get an idea of the color we're talking about. And it can look like blood if it's really like this. I could see where you could think this was blood. So if you have any doubt, just save the diaper and ask. We're used to looking at diapers, don't worry. Okay, I'm going to touch briefly on vaccines. As you can imagine, vaccines in and of themselves are an entire hour-long talk. The bottom line for me is that shots do save lives, I have no doubt. The best way I can explain to see it from my point of view is that anything that we do or give you can have a side effect or a bad reaction. So if you come to me with pneumonia and I put you on Augmentin, you can, in theory, have an anaphylactic reaction to that and die. But we would never not treat pneumonia because of that theoretical risk. There's more risk in not treating pneumonia than in taking the antibiotics, and I see vaccines the same way. Can never promise 100% that everything's going to be okay. Baby could have a reaction, but I truly believe that the odds of a vaccine reaction are greatly outweighed by the odds of getting sick. So that is the way I see it. Absolutely 100% without question, no doubt. I think that the benefit outweighs the bad. So a lot of people are asking about delaying immunizations until they're 2, 4, 6, 10. You're sort of, in my opinion, missing the point if you wait until they're 2. A baby that is 2.5 and gets pertussis is probably going to cough and be miserable for a week, but will probably do fine at home. A 2-month-old that gets pertussis is going to be in the hospital, is going to get really sick, is going to be in big trouble. So that is why we do immunize early. I would advise you to talk to your doctor about your concerns. We can't make you feel better about them unless you ask us, and go in with an open mind. And best piece of advice I can give you is read some good sources, make your decision, and then back away from Google, because you really can read in circles for the rest of your life and change your mind 8,000 times. So just make a decision and stop reading.